Pneumonia is defined as an acute infection and inflammation of the lung parenchyma. Anytime there is an infection or injury to the body's action is to cause an inflammation, which means that the alveolar tissue is going to get inflamed and it's going to leak with fluid. And this fluid is going to leak into the air sac, which will affect the gas exchange mechanism. This is a comparison of the alveoli between a healthy individual and a patient who has pneumonia. In a patient who has pneumonia, the alveoli get filled up with fluid, which increases the thickness of the membrane, and therefore this results in a decrease in the gas exchange mechanism. The major pathological changes associated with pneumonia are inflammation of the alveoli, and if the infection has progressed, then the alveoli also become filled up with fluid, RBCs, leukocytes, and macrophages. When this occurs, the lungs are said to be consolidated. This may also result in atelectasis. Based on where it is located in the lungs, it is classified as unilateral or bilateral. In the case of lobar or segmental, an entire lobe or segment is affected. In the case of air spaces, that is bronchopneumonia, the pneumonia can be seen throughout the lungs. In the case of interstitial, the interstitium, that is the interstitial space around the alveoli, gets filled up with fluid. Pneumonia can be caused by various microbes such as bacteria, viruses, fungi, protozoa, etc. The bacterial causes can be divided into gram-positive organisms and gram-negative organisms. The gram-positive Streptococcus pneumonia causes about 80% of all bacterial pneumonias. And gram-negative Haemophilus influenzae Klebsiella are much more difficult to treat because of the presence of their complex cell walls. The viral causes are influenza virus, RSV, etc., and the other causes may be due to tuberculosis, CMV, and also due to aspiration pneumonitis. Pneumonia is often classified according to the method of exposure. In a community-acquired pneumonia, the infection is acquired outside of the hospital or during the first 48 hours of hospitalization. In the nursing home-acquired pneumonia, the infection develops in a long-term care facility. The hospital-acquired pneumonia, also called as nosocomial pneumonia, is defined as a pneumonia that develops 48 hours or longer after admission to the hospital. In a ventilator-acquired pneumonia, the patient will get pneumonia after they have been intubated. This is because in the intubated patient, the upper respiratory defenses have been compromised, and therefore this provides a direct route from outside to the inside of the body, and things like bacteria, viruses, fungi, etc. can get in, grow, and cause an infection. This is a visual representation of a patient on a ventilator. The ET tube has impaired the natural protection and clearance system of the body, which has allowed the aspiration of microorganisms directly into the lungs through the ET tube. This will result in the alveoli becoming contaminated and infected, causing pneumonia. Created using Powtoon.